first female surgeon, I said she must come on Womanity. I must have her. So thank you for saying yes and for making time for us.
Very happy to be here.
Oh my goodness. I don't believe it. You know what? I'm thinking, how does one become the first anything, let alone the first surgeon, female surgeon to even... That's amazing.
Yeah, I think it is, well, at least from my point of view, it's predestined. Like, it's not like I went into school with this notion like, I'm going to be the first Zambian female surgeon.
Yeah.
No, it just so happened it flowed.
Yeah.
I did my medical school. I looked through the various categories that you can specialize, and general surgery is what came to heart after having gone through school, and you see what you like or what you can handle. And I went on to my surgical journey, and it's only after I graduated, I was practicing, and after this was 2014, we have a Zambian, a University of Zambia Women's Association, something like that. And they were awarding females who were in male-dominated professions each year on Women's Day, International Women's Day.
Yes.
And in 2014, they decided to award the surgeons. So they invited us, and we went. It's usually a dinner in the evening of Women's Day. This story sounds
like you're about to tell me that you didn't know that you were the first Zambian female.
That kind of thing.
No.
Well, I did, but it's not something that I carried on my sleeve. You know what I mean?
Yeah.
So when we were called, at that time in 2014, we were 5 of us. And so when they called us out and gave us the awards, I realized, okay, I'm the senior most person here.
Wow. Man, congratulations.
And that's after that I was profiled by one of the papers, and, that's when I felt, okay, I did open a door.
Yes. We'll come back to that, because sometimes women are also very quiet about our achievements. Because trust me, if that was the first male... the whole world would know about it, and you're like, yeah, no, I'm just doing my job. So we'll get back to that and the branding issues around all of the work that you're doing and currently what you're doing now. But I want us to go back to the beginning of your life, just so we know you a little bit. Like I already said, first Zambian female surgeon, which means you are obviously Zambian. Tell us a bit about the kind of family you grew up in. Were you around other medics, or I don't even know if you call them medics, but what kind of environment did you grow up in? Because I know that what you're exposed to usually leads and guides where you end up potentially.
I grew up, both my parents started off as teachers, and I was actually the first doctor in the family. So I grew up in this home. I was the second born of 6 children. My mom was a teacher who later became a unionist, then became a politician in the first government, in Dr. Kenneth Kaunda's government.
So she was also one of the first to enter that space.
Well, no, there were a number of women in the first government,
and she was. But
she was a freedom fighter.
Look at that.
And so we learned. You won't believe she passed on in 2022, and from her history, we learned a lot. Like you're writing, and people are giving you information, and you're like, wow. There's certain things that we knew for real. Like she came out strong in law. People who studied law in Zambia. There's a case of Christine and 7 others where they marched from, I think, Lusaka to Chongwe or something in support of one of the laws. I think it's something to do with freedom, I can't remember exactly. I didn't do law. But every time you mention your name to even student lawyers, they'll be like, Christine and 7 others. So that bit we knew, but a lot of other things came out of how she participated in the freedom fighting.
Is your mom
of Zambia.
One of the 7 others, or she's actually
She was Christine.
Oh!
And 7 others.
Oh my God. So your mom is Christine.
Yes, Christine Mulondika.
So
Yeah.
it was this is amazing. It's history makers in the same house pretty much, and it's the girls
Yes.
that are doing that.
Yes.
How awesome is that? So growing up, what did you think you would do, seeing as you had a politician mom, a freedom fighter, who is Christine and the 7 others? Did you see yourself getting into politics, or what was your personal dream?
No,
and vision?
I was very sure I was not going into politics. I wanted to do medicine. I think by the time I was in secondary school, I was sure that's what I wanted to do. Like, I liked helping people and stuff like that. And what better way would I do it? I was very sure I didn't want to just be in an office and so on. So I decided I'd do medicine to help people. And when you're sick, that's like one of the lowest points where you really feel like you need to be helped.
Yes.
So by the time I was finishing my secondary school and going to university, I was very sure I wanted to do medicine.
But you just didn't think you would end up in surgery, I assume.
No. The specialization actually grows on you as you're going through the different areas of medicine. And you focus on the 4 main specialties of medicine, which is internal medicine. That's the one that deals with all the hypertension and the malaria and so on. Then you have the general surgery. And then we have pediatrics, which is children's medicine. And you have obstetrics and gynecology. So you go through those 4 in 5th year. At the level of 5th year, our program is 7 years. And at 7th year, you go through them again. By the time I was finishing my internship, after that you do internship. In my time, we're doing it for a year. It's now 18 months at the moment, but I think they're considering bringing it back to a year. I settled with between pediatrics and surgery. But then pediatrics, when I went through it again as an intern, I used to get so affected with kids passing on. And I said, I won't be able to handle this. I'll have a funeral every day. Like, you go home and say, oh my God. So by the time I was done with internship, I was very sure I wanted to be a surgeon.
What is one of the most dangerous surgeries that you have ever done in your time of work?
I wouldn't call it dangerous, but one time we opened an abdomen because there was intestinal obstruction. This is where your intestines, your large intestine is twisted, and so the abdomen is really swollen. So I was assisting with one of my consultants, and we untwisted it, and you cut out the part which was bloated because it's almost dying. So there's blood vessels in the abdomen on the intestinal configuration. So we had removed the redundant intestine, and we had clamped all the vessels and tied them and so on. And at some point, one of the big ones, the tie, we call it a tie, just came off, and there was blood shooting into the ceiling. But he was so quick. I was like, wow, this is where you forget that you're supposed to be part of it. You become a spectator. The way he quickly we controlled it with our hands and retied those blood vessels.
This is like, Matumbo.
Yes, Matumbo.
Okay.
And this is something that I was so glad it happened then, because then you corrected it. Because you can close an abdomen and you get a suture slip, and then you'd have to open again. Then that weakens the patient because they've bled by the time you're coming in, sucking out the blood and finding your bleeder and tying it again. Yeah, so that's... Otherwise, dangerous? No, not really. Surgery is not dangerous.
It's not dangerous because you're skilled.
Yes.
And you are educated and you know what you do. For the rest of us, the moment you open a human, it's like they're open. It's done. Oh my gosh.
Yeah.
All right. So there's plenty that we could get into. We're going to soon be taking a break to hear more about your transition, though, because obviously you're now retired, and I understand that in 2006 you were diagnosed with a back problem. Mm-hmm. Was this from the work that you were doing, or tell us a bit about that?
Well, it was spondylosis, lower back and cervical. It could happen to anybody, but then again, you stand a lot in surgery. You can stand for 24 hours, of course, with short
hours.
breaks.
Yes.
But sometimes, depending on how busy your day is, for your call day,
right.
when you
Because
get into theater,
different.
it's like, you finish the next person, you scrub down. By the time you're done with that, the next patient has been wheeled in, so you're scrubbing again for the next one. So now and then I also had cervical spondylosis. This is the spine of the neck. So again, you are always like bending. So I was prone to it, because not everybody comes out with. I was prone, and then I was in this long standing and bending over. But my cervical spondylosis went away with the initial treatment of physiotherapy and painkillers and so on. But my lower back kind of persisted until I decided, okay, I think let's give this a break.
So how long were you cutting before you decided you take a different route in medicine in that term?
Essentially, because I started my program in 1992, I can say we started cutting probably a year later, like 93 up to 2006.
Wow.
So that's like 13 years or so.
We're going to take a short break. When we return, we'll talk about transitioning from cutting to wellness, because her brand also changed. The direction that she took in medicine is now looking different. Retirement, what does that look like? Many of us get so attached to the work that we do, the titles that we have, that we become what we do at work. But I want to find out how she's been able to navigate that while still, wearing the hat and title of being the very first Zambian female surgeon. Stick around, you're watching Womanity. Welcome back. If you're just joining us, Womanity is the name of the program. I'm joined by Dr. Jackie Mulwanda, who is Zambia's first Zambian female surgeon, and we are so blessed to have her on set with us. And I'm so glad that we're getting to hear about your story. And I'm here sitting next to a history maker, sitting next to a legend. History. My gosh, this is exciting. Now, talking about the transition that you had to make, especially after having the back issues and getting into admin at that point, like getting more into an office space than cutting, I'm sure. How did you handle that? Because sometimes we are so attached, as I was saying before the break, we're so attached to the titles that we have, the accolades that we carry that are attached to the work that we do. How did you manage to move from that and transition into something different? And you can clarify on what that something different looked like for you.
Okay, interestingly, about 2006, I had gotten a scholarship to do a master's in public health. So I went and did a master's in public health in University of Alabama, Birmingham, America. And that was like an 18 months program. So as I came back, and I'm like, okay, so do I veer off into public health? Which means, going into really office work and stuff, and you do also field work. But I think I was still attached to the hospital. So I came back to the Department of Surgery, and so they gave me more of an administrative responsibility. I was looking after casualty, which is the entrance of surgical patients. Like in other places, we call it the ER, but the ER really, emergency room, covers both just medical patients and we called it casualty at that time. And I was looking after intensive care unit, which is critical care. And in both situations, yes, like on the spot, if something came, emergency, you have no choice but to join in it, because you're not used to watching something happening without doing it. But I was more, in both places, I was more administrative, like just making sure things are running properly.
Could you breathe? seeing that? Like just not doing the actual cutting. How did that play on your mind? And how did you let it go? Did you find that the administrative work would give you an opportunity to impact the space more? How did you let go?
Well, I let go because I knew it doesn't help to stand and not be able to do the best, because pain is pain.
Yeah.
And the back pain is back pain. But I think because of the break I took to go to school, that also helped. Like, I'm going back. How am I going to handle this? But I felt good that I was still in the department of surgery and just put into aspects of surgery where I don't really have to cut. And I'll tell myself, I could cut sitting. And again, that's not...
Yeah.
That's not the norm.
Finding every way to stay. And it's like, no, it's time.
So I said, okay, no, we'll just go on with the critical care. So I kind of got more interested in intensive care, management of patients. And at that time, our intensive care, even now, is an open one, but we don't have intensivists. So when people are admitted into intensive care, the doctors who send them, they will still come and review them. But then you're the one on the ground, even though I'm doing administrative work. But if there's any emergency there or anything, I'm the one who was there. Until a few years later, they started posting doctors there from anesthesia. And so I became more administrative than hands-on. Yeah.
You now work in. First, let me ask when you retired.
I retired December 2023. I'm not even
That's
a year
not too
much.
long ago. That is not too long ago. But I know that you're now working in wellness. So health and wellness. What does that transition look like for you? Because now stepping away from the office and from surgery to now having this other kind of different conversation, because you're not cutting anyone now.
Actually, the health and wellness idea came even before I retired. Like possibly a good 5 years before I retired. I told myself, after I served for 34 years when I was retiring, after all I had seen, I'd been the caregivers and the doctor. I had been a patient myself. I'd been a bedsider for various patients. I had my own mom and so on. And I said, I think I would rather tell people not to get sick. This is a stressful process altogether, wherever you are, So I got that idea. I said, no, I think I'm going to go into health and wellness. Teach people how to be well, how even as simple as just drinking enough water and being well rehydrated will keep your body running better than the 1 glass of water people want to say. Do you drink water? But I drink a glass of water in the morning. Really? Okay. Exercise is another thing. A lot of people talk about exercise, but it's like, I go to the gym sometimes, or I exercise at home and so on. But when you put everything together in health and wellness, and your body will be strong enough to fight off the disease. And I told myself, if I'm still on the medical side, the curative side, let me do 10%. Let your body do 90% of the healing, fighting off those germs of healing of traumatic injury, Let your body be ready to start healing, and let me just straighten out the bone so that it heals in the proper position and so on.
What would you say are maybe 3 key things that anyone at any stage in their lives could do right now, like today, as they're watching this, they could actually start on to get to that health and wellness space, so that you only get to do 10% of the work, that the hospitals are there to just do some of it and not from the ground up. What would your advice be on that?
I think water is always my first thing. The value of rehydration is really probably not understood. But these are cells, different cells, blood cells, tissue cells, everything. And if you are not rehydrated, they actually shrink. So they are not working as they should. Your blood flow, if you don't have enough water in your system, it will thicken. And then you get all these strokes. You get all sorts of things. So just rehydration, even aches and pains. These are muscles not well hydrated. And so even I see it now myself. I try to drink as much water as I need. But when I don't, I get spasms. And I get muscle spasms in all sorts of muscles, even in one of the tiny muscles in my foot. And I'm like, how much water did I drink yesterday? You know. So water is like the first thing. And diet, I won't say diet, fiber, taking fiber, because when your gastrointestinal system is not functioning well, when you eat your food, it's supposed to go down, the nutrients are removed, and you pass out what was not needed. Because what happens is that if the gut is not mobile, if you're not emptying your gut, you keep the toxicity. You're keeping things that are not supposed to be there, and the germs will grow. They're happy, you know. And so fiber-rich food. For me, I'm not a person who will say, don't eat this, don't eat that. No, don't eat red meat. I'm like, sometimes it's difficult. Where, at what level am I? What kind of food do I afford in my house? You know?
Okay, yes.
That kind of thing. So to control a diet to restriction of this, that, and the other, I find that a bit difficult.
So water, rich
fiber-rich foods, and exercise.
You've got to move your body, right?
Yes.
Okay.
And it can be just walking around intentionally. You know, now we have this smartphone and smart watch where people say, today I walked, I don't know, 1,000 steps. No, you were just walking. Maybe it was just a sludge or, you know. But then I said, no. Today I covered so many steps and so many calories lost.
Yes.
Really? It's got to be intentional.
Okay.
It's got to be intentional. Like right now I'm exercising. When I'm taking this walk around the block, I'm doing it because I want to exercise.
Yeah. But I hear 30 minutes a day should do a trick.
Yes.
Somewhat.
But even that 30 minutes should be intentional. Like, I believe in dealing with people who know these things. There are people who've gone to school to tell you exactly how you should move your body. We have physiotherapists in the hospital, but then there are even gym trainers who go and learn how you're going to move your forearms and whatever, every muscle, and how you exercise your cardiorespiratory system so that you continue breathing and so on. I discovered during COVID, when my husband got COVID, and this is something, of course, you've learned, but just blowing a balloon for your respiratory system when your oxygen levels are low. Just that, intentionally blowing maybe 5 balloons, you take a rest, again you blow them, within a short time, you are actually opening up the little bronchial spaces and everything, and your chest will actually
I'm going to buy a few balloons. I'm going to buy a few balloons now. Well, as we're closing, you said something about your husband there. You and your husband went to school together in the same class.
Yes.
And he too is a doctor.
And a surgeon.
Oh my goodness.
We met at medical school.
Yeah.
And we're in the same class. We finished our 7th year. We did internship. Yeah, we did internship in the same hospital. Then we parted. I went to do rural posting and he went to the mines, I think. Then we came back in the same class for surgery as well.
Were you already dating at the time?
Yes, we met at medical school.
I love it. It's romantic. Surgically romantic.
Surgically romantic. I like that term.
Oh man. And I think I would not do you justice by not mentioning that you did have a son.
Yes.
Who was a fellow
doctor.
Yes.
We're a house of doctors.
Man.
Yes.
And how many children?
No, we just had that one son. Yeah, and he passed on in 2021, June 23rd, 2021, after a COVID infection. But he had worked in the COVID center for 2 weeks. He got an infection, but it was one of those which you just isolate. He came home because he had his own place and was at home and was, according to everybody else, I mean, I used to sit with him. We were together most of the time. His cousins, his friends would be like, oh, can we come and see you? And she was like, no, I'm feeling okay. I think I should be back home in the next few days, so you can come see me at home. But then he had a complication. And there I say thank you, I'm learned in the profession. He threw an embolus, what we call an embolus. And after post-mortem, it came out, the diagnosis was a massive pulmonary embolus. So he threw this clot into his lungs and just blocked out the arteries in his lungs. So it was like 1 minute you're talking and everything, then we get up, but okay, let's it's time. And he walks a bit and he stops. So what is it? He's feeling a bit weak or something. So I tell his dad, okay, so like, why don't he lean on your back? And so that we don't have to walk, stop. And he does that, and we walk up to his bedroom. And as he just leans over to put him on the bed, he goes into respiratory distress.
And that was it?
And I was like, he's thrown an embolus. So, okay, let's call an ambulance and so on and so forth. 3 hours later, he died. He died, but we went on the ambulance, reached the hospital where we were supposed to go. They couldn't even take him out on the ambulance. We actually started resuscitating me and his father in the ambulance because we could tell that now he's kind of going down.
You now have a foundation?
I am working on it. Because I said, okay, how do I keep this legacy, young legacy? But you know, when I heard what people said, his colleagues, his friends, I was like, no, I think we need to uphold this somehow.
Was he a surgeon as well?
No, he was an intern. He had just qualified. Yeah. But he was like, I could see the inclination to surgery. And then again, he would come home and I said, you know, all my friends are want to do public health. I'm like, by the time you're done, you know exactly what you want to do. Then one time he was like, these human beings, I think I'll do pathology. I said, you're not there. I said, you're not doing pathology. You want to go and be doing postmortems every day? No, you're not going there.
Man.
So yeah, that was our son, Edwin.
I thank you for sharing a bit about him. And what a beautiful family, clearly. Yeah. Medicine runs in the vein, and also history making in your lineage, starting with your mom and yourself, and just a family that's done really well for themselves. I thank you for joining us. I thank you for the impact that you're making. So we're going to get on that water, we'll get on the exercise, and what was the other thing? Food. Fiber-rich food. And a balloon.
Thank you so much. Thank you. I came to Malawi to do the Real Women Summit. I had no idea I'd end up in a studio.
I was waiting
with my dear friend.
Thank you so much.
Pleasant.
Thank you. Well, to everyone at home, thank you for joining us. I'm sure you are as blessed as I am today to have Dr. Jackie feature in your home. How good is that? Until next time, drink loads of water. I'll see you soon.
We asked the children, how many of you brushed this morning? And this little boy, his hand didn't go up. And I said, well, why didn't you brush this morning? He said, my brother was using the toothbrush. If I